14-year-old Khadija Shahid has been a patient at the Family Health Center in Baltimore City since she was a baby.
Hi, Khadija.
Hi.
How are you?
Good.
All right, table.
And Dr. Bernard Abbott has been Khadija's pediatrician for all of those
Why are
years.
you here today? What happened?
I dislocated my kneecap.
How did you do that?
I stepped in a ditch and my leg twisted in it. Dislocated.
Ouch. Are you in pain?
No.
As Khadija's primary care physician, Dr. Abbott knows her medical history and her family better than a specialist could.
And did they do x-rays?
Yes.
All right.
And today, Khadija is getting some extra attention from University of Maryland School of Medicine student Helen Cheung. In her first year, Helen is working in Dr. Abbott's office to learn firsthand what primary care is all about.
You not only have to be a clinician, you have to be a psychologist, you have to be a social worker. It involves everything that you need to do for not just the patient that day, but for the entire family.
You have the unique opportunity to kind of address any mental health concerns that they may have, and also the social determinants of health. And you get to, see families and being able to interact with the children and get to know their parents. I think that gives you a really complete picture of what the family dynamics are at home, and I think that helps you better coordinate the care that they receive.
But there is a critical shortage of primary care physicians, especially in underserved rural or urban areas.
Around the world, most countries, most societies have a ratio of approximately 2/3 primary care physicians to 1/3 specialists. In the U.S., that ratio is flipped for the most part. It's roughly 1/3 primary care, 2/3 specialists.
Dr. Abbott has practiced at the Family Health Center for 34 years and has witnessed the shift away from primary care, a trend driven by social, political, and economic factors.
A lot of the young providers coming out of residency now, they want financial success relatively quickly.
The shortage, it concerns me because when you have less physicians, you have less opportunities for follow-up. You have less opportunities to focus on that preventative aspect of health. And because of that, I'm worried that people's health outcomes will decline because of that shortage, and that will put further strain on our healthcare system.
But thanks to her hands-on experience in the community, Helen knows there are extraordinary rewards for practicing in the primary care field, especially the opportunity to make a difference in the lives of patients.
My hope is that instead of treating kind of the symptoms of acute illnesses, we can focus and shift the paradigm into more preventative health, so that way patients can have better health outcomes.
For the University of Maryland School of Medicine, I'm Larry Roberts.